Let me ask you this, in a sense, philosophical question. We've gone a little bit into philosophy today. I believe, many people in my own state believe that healthcare is a right, R-I-G-H-T, regardless of income, that every American has the right to the best quality healthcare that the system can offer regardless of income, that if you're a low-income kid, you're a wealthy kid, you have the same opportunity to access the healthcare system. Do you believe that?
I believe that every person ought to get good health care, and the Hippocratic Oath says that I would provide health care regardless of whether the person pays me or not. So I definitely believe that people need health care.
Give the mic over to Senator Paul.
Thank you very much. With regard to the idea of whether or not you have a right to a health care, you have to realize what that implies. It's not an abstraction. I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery. It means that you're going to enslave not only me, but the janitor at my hospital, the person who cleans my office, the assistants who work in my office, the nurses. If you have a right to their services, basically, once you imply a belief in a right to someone's services, do you have a right to plumbing? Do you have a right to water? Do you have a right to food? You're basically saying that you believe in slavery. You're saying you believe in taking and extracting from another person. Our founding documents were very clear about this. You have a right to pursue happiness, but there's no guarantee of physical comfort. There's no guarantee of concrete items. In order to give something concrete or someone's service, you got to take it from someone. So there's an implied threat of force. If I'm a physician in your community and you say you have a right to health care, do you have a right to beat down my door with the police, escort me away, and force me to take care of you? That's ultimately what the right to free health care would be. If you believe in a right to health care, you're believing in basically the use of force to conscript someone to do your bidding. Now, just because it's a noble thing to believe that we are obligated as Christians, we are obligated through the Hippocratic Oath, we have always done this. Since the beginning of modern medicine, we have always provided 100% access. I do it in exchange for privileges. I do it because I believe in the Hippocratic Oath, but my hospital also says to me, you can only operate in this hospital if you agree to see everyone coming through the emergency room. I always have. We have always treated. We have always had 100% access through our emergency room. Those were for emergencies. They're not the best place for primary care. We all agree with that. But we've always had 100% free access.
I think it's fair to say that Senator Paul and I have some slight philosophical differences. My profound question to Dr. Krause is, do you, as an employee at a federally qualified health center, consider yourself as a slave?
I love my job. I chose to work there. I do not feel like a slave. Thank you.
Ms. Draper, the implication, again, from my friend Senator Paul, is that we have kind of solved the problem of health care access in America, that any place in the country, I guess, anybody who has a problem, if you're on Medicaid, if you have no health insurance, maybe if you have health insurance, you just walk in the door tomorrow and find a doctor to treat you. Is that true, in your judgment?
Well, there's a huge body of literature that discusses the difficulties particularly Medicaid beneficiaries have to finding a physician. There are many physicians who are unwilling to accept Medicaid patients, and also for those who are uninsured face equally challenging or maybe more so challenging access issues.
All right, my last question is for Dr. Krause. Again, picking up on Senator Paul's comment. As you know, Vermont is moving toward a Medicare for all single-payer approach. Are you worried that if we consider healthcare as a right in the state of Vermont, that the St. Johnsbury Police Department in the middle of the night is going to break down your door and force you to treat a patient? Is this an immediate concern of yours?
No.
Okay, thank you. I want to thank Senator Paul for being here, and it was a provocative, interesting discussion. I want to thank mostly the panelists for being here. I think we're discussing an issue of great importance, and again, thank you all for your participation. When we talk about prescription drugs, it's important to understand that in our country, we pay by far the highest prices in the world for prescription drugs. That's simply the reality. And that causes enormous problems because millions of our people go to the doctor writes a prescription, and then the person can't afford to fill that prescription. So that's pretty crazy because doctors are doing the diagnosis, telling the patients what they need. Patients can't afford to pay for the drugs because they're the highest prices in the world in this country. So, Mr. President, this is an, an issue that we have got to deal with. Now, there are a number of reasons why prices in this country are higher than in Canada, Europe, Scandinavia, and certainly one of them is that we are the only major country on earth that doesn't have a national health care program so that the government can negotiate prices with the drug companies. So what happens in this country is the drug companies simply charge us what the market will bear, any price they can come up with by which they can make money. And the end result is that we pay, in 2009, prices in this country were 85% higher than Canada, 150% higher than France, Italy, Sweden, and Switzerland, and so forth and so on. But the reason the drug prices are high in this country is not just that we don't have a national health care program, it's because of the enormous amount of fraud that takes place within the pharmaceutical industry. In fact, every single year, the major drug companies are ripping off the American people to the tune of billions of dollars a year because of fraudulent practices. Virtually every major pharmaceutical company in this country has either been convicted of fraud, i.e. ripping off federal government, state government, or individuals, or else has reached a settlement. And we have got to get a handle on this crisis. Now, I want to read. I'm going to bore some people because it's a long list. Sadly, it is a long list. But it's a list that has to get out, and it is an issue that we have got to deal with. So here we go. Abbott Labs is one of the top 10 pharmaceutical companies in the world. It had $38.8 billion in revenues and $4.7 billion in profits in 2011. Just last month, Abbott reached an agreement with the U.S. Department of Justice to pay $1.6 billion for illegally marketing the anti-seizure drugs Depakote. Pfizer is the largest pharmaceutical company in the world, $67.9 billion in revenues and $10 billion in profits in 2011. Pfizer, in 2012, this year, Pfizer allegedly avoided paying hundreds of millions in rebates due to state Medicaid programs for Prontonix. Johnson & Johnson is the second largest pharmaceutical company in the world, which had $65 billion in revenues and almost $10 billion in profits in 2011. In 2012, this year, Johnson & Johnson illegally marketed Risperdal, an antipsychotic medication, to nursing home patients and paid over $2 billion in fines. GlaxoSmithKline is, again, one of the largest pharmaceutical companies in the world, made profits of almost $44 billion in 2011. GlaxoSmithKline in 2011 announced that it had reached, quote, an agreement in principle, end quote, with the U.S. government to pay $3 billion, $3 billion, to conclude the company's most significant ongoing federal government investigations. Mr. President, in 2010, the pharmaceutical industry achieved a dubious distinction. It surpassed the notoriously corrupt defense contracting industry in defrauding the government. The pharmaceutical industry accounted for nearly half, $1.8 billion of a total of $4.1 billion of the penalties collected in 2011 by the Department of Health and Human Services Health Care Fraud and Abuse Control Program. In 2012, and this is really quite amazing, the pharmaceutical industry is expected to pay out up to 4 times the amount of last year's penalty, between $8 to $9 billion. $8 to $9 billion in penalties due to pending fraud settlements with the Department of Justice. Virtually every major drug company has either been found guilty of or settled charges of significant fraud over the last 10 years. The question arises, and this really is an important question: is fraud within the pharmaceutical industry the exception? Does it just happen here or there, or is it simply put their business model? Is fraud the business model of the pharmaceutical industry, who think that in most cases they can get away with the fraud, make huge profits, and in some cases when they get caught, they will in fact pay a penalty, but the penalty will in no way match the kinds of huge profits they're making from their fraudulent activity. It is clear that the punishments that we now have on the books have not done enough to address this problem, because apparently the drug companies are not too intimidated by the laws on the books. They think it makes business sense for them to continue going forward on their fraudulent activities. The amendment that I am offering would send a strong and clear message to the drug industry. Illegal behavior will not be rewarded with continued government-granted monopolies. Our people are paying the highest prices in the world for prescription drugs. One of the reasons is widespread fraudulent activity on the part of virtually every major drug company in our country. It is no longer acceptable to turn a blind eye to that crisis.